definition of the written would be beyond our scope. So I just would like picture you picture the tracing. Matatandaan nyo na. Pag nakita nyo, once na nakita nyo, every time na nasa area kayo or during the time na you could apply your BLS at merong AAD or defibrillator or monitor, maalala nyo na lang yung tracing. Yun yung important. Okay. So if you don't have any questions from previous lecture, our topic, this is the summary for our last topic. Exam for the last two rows. No? This is applicable for the KCLS. So if you're going to memorize this table, pasok na kayo for the KCLS. Plus of course the medications, important medications nakasama doon. Inotropics like dopamine, dobutamine, epinephrine, norepinephrine, atropine. Yun lang naman mga tatandaan nyo when it comes to KCLS. But for BLS, no medications. This table except the last two. So kung mag-ACLS kayo, you're scheduled for the ACLS, you memorize this table, hindi na kayo mahirapan. Plus, of course, the lecture sa basic. Okay, for a review, this is the pediatric chain of survival. So, first chain would be prevention or safety. Second,
early
compression or early recognition. Third,
activate EMS.
Activation for the EMS. Fourth,
Effective
transport. And fifth, condition management. Same with the adult.
Activate.
Okay. For adult, so the reason why telepono yung nauna, which means activation muna, because of ano rason? Ha?
Cardiac.
The origin for arrest is cardiac. So you need the defibrillator. Okay. So immediate activation of the EMS, and second,
Early CPR.
ano?
Early CPR. Early chest
Same with the
compression.
pedia.
Early chest
CPR.
compression.
Third,
Defibrillator.
defibrillation. And fourth, same with pedia. So sa pedia, walang defib. But it's more of defibrillation applicable sa adult. Okay. So the electrical therapies, this guidelines will cover tatlo lang naman. So it's a very short topic. Defibrillation, we have the manual and the automated external defibrillator. Ang lakas naman ng flash drive. Third, synchronized cardioversion and pacing. So for this topic, just remember the difference with defibrillation and cardioversion. So AADs usually may be used by lay rescuers and healthcare providers as part of the basic life support. So manual defibrillator, cardioversion and pacing are usually for advanced. So yung AAD lang ang isinama, pero part ng defibrillation yung AAD, which is the automated external defibrillator. So yan ang kasama for 2010 guidelines for the
Dito siya.
BLS. So defibrillation, manual, cardioversion, and pacing are usually for advanced life support therapies. And AEDs can now be used in infants if a manual defibrillator is not available. So yan yung bago sa guidelines. And the in-hospital use of AED may facilitate early defibrillation, and the goal would be less than or equal to 3 minutes. Okay. The outcome, ayon sa study or recommendation, is mataas yung survival. Okay. If you could use the AED less than or equal to 3 minutes. So what is defibrillation? It is the therapeutic use of electricity to depolarize the myocardium and thus allow more coordinated contractions to occur. The term is usually applied to an attempt to terminate a non-perfusing cardiac arrest rhythm. So non-perfusing cardiac arrest rhythm, meaning the non-perfusing cardiac arrest rhythm like ventricular fibrillation or pulseless ventricular tachycardia, allowing normal electrical activity to occur. So dalawa lang yung sample na binigay na non-perfusing rhythm, no? Which is the VFib, ventricular fibrillation, and pulseless ventricular tachycardia. So you have to note for the pulseless and the ventricular fibrillation. So these are the example for sa monitor. Yan yung example ng VFib, irregular rhythm. So walang PQRS. No? Pagdating nyo sa cardiac, no? Subject for tissue, ECG, or rhythm, different rhythms. Doon yung makikita yung PQRS. So sa VFib, ventricular fibrillation, hindi nyo ma-identify yung P, Q, R, saka T. So ganyan yung itsura. Iba din naman yung sawtooth na tinatawag.
Atrial flutter.
Okay? That's flutter, yes. So VFib, and yan yung sa taas. Pareho nung dito sa kaliwa ko. Pero yung lower tracing, that's the ventricular tachycardia. So pulseless VTAC, or it could be VTAC with a pulse. So magkaiba yun. So ginagamit ang defibrillation for pulseless ventricular tachycardia. Okay? So pag nakita nyo sa monitor yung ganito tracing up and down, most likely pag VTAC, sinabing tachycardic, ventricular tachycardia, the beats is usually more than ilan? Pag VTAC. Pag tachycardic, more than 100. Pagka ventricular or supraventricular tachycardia, kasi may iba, pulseless SVT, pulseless or pulse, with pulse SVT, supraventricular tachycardia. So it is more than 150 beats per minute. So makikita nyo regular siya. Identify nyo yung QRS, pero most of the time walang T. Pag dumating sa ER, wala kayong ma-appreciate sa blood pressure sometimes. Pero yung iba, naka-appreciate sila ng pulse. So pag may pulse, kailangan ba nating tipid? O hindi? Hindi. So pag pulseless, tapos sa monitor ganyan, impending yan, pwedeng magkaroon ng VFib agad. So I want you to remember yung tracing na yan, kasi doon yung ma-identify kung kailangan nyo mag-VFib or hindi. So it comes to a patient coming from the ER, pagka dinala nila, may nakapaka yung pulso, or pagkakita nyo, wala kayong makapat, no? Na pulso, then pagkabit, may tracing, you have to check if it's really beta or not. Okay? So, the indications for defibrillation, sabi ko nga, dalawa lang, defib and pulseless beta. It is contraindicated. Defibrillation is contraindicated for asystole, pulseless electrical activity, sinus rhythm, conscious patient, of course, with the pulse, where there is danger to the operator, or others, like when patient galing sa swimming, nag-arrest, meron kayong AED or defibrillator sa labas, bawal gamitin. Okay? Asystole, pag flat. So, hindi totoo yung sa TV or sa movies, kapag nakita nilang flat, kinukuryente. Pelikula lang talaga yun. So, pulseless electrical activity. Ano yung pulseless electrical activity? PEA. Bumabato siya, merong QRS, pero wala kayong pulso. At saka ang haba. That's PEE. Mahaba yung space. So, hindi nyo ma-identify yung P, Q, saka RS. Pero may nakikita kayo sa monitor. Top. Top. Sinus rhythm, of course, normal. Conscious patient. Alangan naman yung defib nyo. So, i-convert nyo yung normal into abnormal pagkagat. So, these are the features for manual defibrillator and the automated external defibrillator. This type of defibrillator is the biphasic. We have two types of manual defibrillator, bi and the monophasic. When you say bi, it's the monophasic, the biphasic. When you say monophasic, no, isang polar lang. So the highest recommended is ilan? 360. So may nakalagay dyan dito. 360 yung pinakamataas. When it comes to adult, hindi na kayo magpo-compute. Pag na-identify niyo pulseless beta or ventricular fibrillation, ang rhythm, push the button, 360. Pag okay na, defib. Okay? So, ito yung pads. Ito battery. So, this is the monitor. Okay? For biphasic, the highest is ilan? Ito yung sa joules. Dito. Ito naman dito. So, you have to adjust. This is the one we're using sa ER dito. So, 200 yung pinakamataas. Okay, this is the pads. Panyo guys, itong pads na to, pwedeng i-apply for pedia. Tanggalin lang yung adult screw type. May maliit na lalabas dyan. Yan yung ginagamit for pedia. But for pediatrics, of course, you have to compute for the juice. Okay, mamaya na nag-apply. And for AEDs, ano lang to, portable siya. So, most of the time, sa mga 5-star hotels, makakakita kayo ng AEDs nasa wall lang, nakamount. Pwede nyo lang tanggalin. This is the red button. Ito yung pads. May speaker dyan. It's like a voice prompt dyan lalabas. Yung iba may monitor dito. They have a monitor. Makikita nyo yung tracing. So, sa AED, kayo magsha-shock. Nasabihin lang pag nakakabit na to sa pads, sa chest. Nasabihin niya, analyzing rhythm, continue CPR. So, ibig sabihin kayo magsi-CPR, continue CPR. After 2 minutes, analyzing rhythm. I'm going to shock. Pero hindi siya mag-shock. Pag tumunog, I'm going to shock. Toot, 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 toot. Gagawin, pupush nyo yung button. Kayo magsashock. Okay? So, hindi yung machine, hindi yung AAT magsashock. So, first, we'll tackle automated external defibrillator. These are sophisticated, reliable computerized devices that usually use voice and sometimes visual prompts to guide lay rescuers and healthcare providers to safely defibrillate, ventricular fibrillation, and pulseless rapid ventricular tachycardia, or the sudden cardiac arrest, SCA. Okay? So, part of it, sabi ko nga, yung nandun kanina sa taas, electrodes, you have the speaker, the text showing information, yung iba wala, the shock button, status indicator, memory, battery. Ano yung importanteng wala dyan? Anong part ng AAD ang pinaka-importante na wala dyan? When you guys, the electrodes, the different sizes for adults and pedia. Iba yung ginagamit for pedia, iba rin yung ginagamit for adults. And for your information, one-time use lang yung pads, no, yung electrodes. Pag ginamit nyo, hindi na pwedeng gamitin sa iba. Pero dahil sa kamahalan, yung iba ginagamit pa rin. So, hindi na siya dumidikit masyado. Nilalagyan na lang nila ng tape. Pero hindi siya ideal, of course. Okay? So, alam kong price niyan, maabot almost 10 yung isang pads. It's a government price, of course. 10,000. Yung isa, ay yung pair na. So, hindi ko alam sa private. Okay? Ano yung most important part ng AAD? Na wala dyan. Wala. So, there are positions, no? On my right, yan yung cycle for activating the or using the AAD. Once you have a patient na nag-arrest, then you start the BLS, activate. Pag dumating na siya, kabit mo yung pads, then the AAD will analyze the rhythm. Pag sinabi niya, continue CPR or start CPR, go CPR, start with the 30s to 2, rescue breathing, and then after, mag-check ulit. Pag sinabi niya shock, push button, magsa-shock. Okay? Ito yan, pagkakabit nyo, analyzing rhythm. Pag na-analyze niya na shockable yung rhythm, sabihin niya shock. Pag hindi naman, continue CPR, 30s to 2. Then after 30s to 2, analyzing rhythm. Okay? So there are 4 positions placing the pads. We have the anterolateral, anteroposterior, and anterior left infrascapular, anterior right infrascapular. And these are usually effective lahat ng position. Magkamaliman kayo, pare-pareho lang. So question, yung bang paddle, pag nilagay nandun apex and base, nagkamali kayo ng paglagay, may difference pa. Accordingly, wala naman. Kasi pareho lang naman yung energy or juice na ibibigay. Okay? So, bakit nakalagay doon ang base? Ba't nakalagay ang apex? Para aware lang tayo, alam natin kung saan ilalagay talaga. Sa pag-aakura, mali yung paglagay. Nag-worry kayo. Nandun yung relative. Naku! Mali yung pagkakalagay ko, nag-kuryente kayo, nabanggit niyo. Mali yung placement ng pads. Nandun yung relative. Patay kayo. Okay. So, transthoracic impedance firstly generates sufficient current to achieve defibrillation. Electric size, usually 8 to 12 cm in diameter. So, meaning yung transthoracic impedance, the greater, no? Since it is inversely generate sufficient current to achieve defibrillation. Ibig sabihin, pag mababa, yung impedance mo, mataas yung current. Pag mataas yung impedance, mababa ang current. Pag mababa ang impedance, mataas yung current. So, ano ba yung impedance? Usually the space. For example, mabuhok yung pasyente nyo. Mataas ba yung impedance doon o mababa? Ha?
Mataas.
Mabuhok. Parang si
Mataas
doktor.
ang impedance. Mababang current.
Mataas, mababa?
Mataas.
Ha?
Mataas.
Mataas. So, mababa yung energy. Kasi, ano yung magkukos ng mababa impedance doon? O mataas na impedance doon? Yung buhok. Pagbasa.
Mataas. Mataas.
Ha? Mataas, mababa. Pagbasa.
Mataas. Hindi ko pala.
Mataas, mababa. Ha?
Mataas.
Basa.
Mababa.
Yung impedance, mataas, mababa. Mababa. Pag naliligo kayo,
Mataas.
for example, sa ulan, may kuryenteng nawala or loose siya. Di ba pinagbabawalan kayo na maligo sa may mga pwede kayo makuryente? Bakit? Ha? Kaya na. Kuryente ka. Bakit?
So, mababa ang impedance.
Ha?
Mababa.
Activity ng water. So, ibig sabihin, pagkat basa yung pasyente nyo, yung impedance niya mataas, mababa.
Mababa. Mababa.
Mababa, mataas.
Mababa.
Ilan ang mataas? Wala. Ilan ang mababa? Mababa siya. Yung kuryente niya, mas mataas.
Mataas ang current.
Anong purpose ng gel? Ba't natin nilalagyan ng gel? Ha? Para? Bababayin niya yung impedance. Para yung energy, nitataas. Okay? So, these are the examples of AL pads. Yan yung regular pads per adult na ginagamit. Right upper half of the sternum and below the right clavicle, usually piniplace yan. So, pagdating sa ER, pag nasa ER yung pasyente, bawal kayo maglagay ng mga chest leads dyan. Kasi dyan nilalagay yung pads. Kung, as a field, kung meron kayong mga monitors. So, the second pad is usually below to the left of the nipple. So, for pediatrics, pag wala kayong pedia size, pwedeng harap at likod pag maliit yung bata. Okay? So, these AADs usually tested extensively both in vitro against libraries of recorded cardiac rhythms and clinically in many field trials in adults and children. So, these are not designed to deliver synchronized shocks. When you say synchronized shocks, dito papasok yung cardioversion natin. Like VTAC with pulse. So, example for synchronized rhythm is VTAC with a pulse. So, it will recommend a non-synchronized. Kailangan magiging pulseless muna siya bago niya mabasa kung shockable siya, i-defib niya o hindi. Okay? So, at this stage, clear ba yung AED? Defibrillation? Malinaw? So, ano yung shockable rhythm?
V-fib with
V-fib and
pulse.
pulseless VTAC. So, saan yung pulseless VTAC dyan? Ha? Narinig ako sa taas. Pulseless VTAC. Saan? Pulseless VTAC. Saan yung pulseless VTAC?
Hindi po ba?
Taas o ba?
Baba.
Ha?
Bita.
Taas, pulseless VTAC. This is the ventricular fibrillation.
Ito na, may
This is the
QRS.
VTAC. Pag tachycardia, VTAC, ventricular tachycardia, usually normal siya. Makikita nyo, tusok-tusok. There are two types of VTAC, no? The wide and the narrow. This is the narrow. Kung mapapansin nyo, this is the wide VTAC.
So cute.
So this VTAC, pwede siyang maging V-fib. Kung napabayaan nyo, magiging V-fib yan. So may mga iba, ito muna makikita nyo VTAC. So pag hindi nyo na nakita to, makikita nyo na lang yung pasyente nyo nag-V-fib na. Okay? Fibrillation, ibig sabihin, abnormal. Actually, they're both abnormal, pero irregular. No? Mas irregular siya pag fibrillation. Pag tachycardic, ventricular tachycardia, pwedeng may Q, RS, pero wala kayong ma-identify na P most of the time. Okay? So it could be wide
Walang pababa.
and narrow, QRS or VTAC. Okay? So mukhang malabo. Ha? Sabi ko, hindi, malabo yung pinakita mo ng picture.
Parehas man yun. Oo.
Tanong, yung dalawang ito kailangan mo i-defib?
Yes.
Yes. Kasi ito nga yung ano eh, ito nga yung
Yung indication.
dalawang rhythm na kailangan mo siyang i-defib.
Okay na. Hindi malalaman.
Pulseless VTAC, kasi sabi ko kanina, pwede siyang with pulse, VTAC na may pulse, pero ang pwede niyong i-defib, pulseless VTAC. Ventricular fibrillation, automatic yan, defibrillation. Wala kayong BP, pwedeng gising ang pasyente, tumitirik ng mata, pero wala kayong pulse, wala kayong BP. Pagdating dito, pwede siyang may pulse, pero ganito yung rhythm. So, pwede nyo i-defib pagka pulseless.
Pero hard.
Okay? So, yung iba na-excite pagkakita, ito yung sinabi ni Dr. Guzman, pinoriente agad. Pagka pa, may puso pala. Sinampal kayo ng pasyente. Mura yung pasyente. Kasi gising. Okay? You're free guys, pagka medyo malabo, free kayo na interrupt ako. Just ask questions. So, AED use in children. Cardiac arrest, usually, sabi nga, more common ang pulmonary or asphyxial in origin. So, cardiac arrest is less common in children and is usually observed 5 to 50% sa adolescent and pediatric arrest. So, the lowest energy dose for effective defibrillation in infants and children is not known, and so with the upper limit. But accordingly, sa recommendation, dose of more than 4 joules per kilogram, as high as 9, effectively defibrillate children and pediatric animal models. So, ginamit nila hayop. Pero, the recommendation usually, the acceptable to use is 2 to 4 joules kilogram, not to exceed the 10. Okay? So, for pediatrics, pag ginamit nyo ang AED or defibrillation, 2 to 4. And not to exceed 10. Okay? So, malinaw? Gagamitin nyo lang, yun ang mahirap sa PEDIA. Kasi i-compute nyo. Hanggang sa pagkuryente, i-compute nyo pa rin. Hindi siya parang adult na 360 pa. Pagdating sa PEDIA, you have to compute 2 to 4 joules per kilogram up to 10. Bakit may up to 10 pa? Kasi pag hindi siya pumalo sa 2, pwedeng iakyat nyo sa 4, pwedeng iakyat sa 5, hanggang umabot kayo ng 10. Okay? So, stepwise. So, for infants, a manual defibrillator is preferred. It's not available in AED with attenuator. Usually, this attenuator, yung mga nurses, alam niyo yung pag gumagamit kayo ng pang-drip, ano yung tawag nyo? For the machine?
Infusion pump.
Infusion pump. Parang ganun siya. So, pwede nyo i-adjust yung energy doon. Up, down lang. Okay? That's the attenuator. Okay? So, the in-hospital use, usually for AED, is very much recommended. Pero apparently, sa atin, going pa ata. So, pinaprocess. Ideally kasi dapat sa school meron din, sa hospital, kahit may ER, may ICU, in every floors, kailangan merong AED. Mind you, we have a convention, siguro mga year 2012 pa tayo, sa malaking hospital, and some of the yung mga bisita, nawalan ng malay, bigla na lang nag-arrest. So, walang gamit. Pati yung ambulansya nila nandun lang. Pero walang tao yung ambulansya. Walang medical team. Mabuti na lang yung mga nandun puro doktor. So, dinala nearest hospital. So, the evidence, no published hospital randomized trials of AEDs versus manual defibrillator. As evidence from one study indicated higher rates of survival to hospital discharge. So the goal is less than or equal to 3 minutes. So despite limited evidence, the AEDs may be considered for the hospital setting to facilitate early defibrillation. So yan yung bagong kasamang recommendation for the 2010. So, the late rescuer AED programs, hindi kasama yan for 2005, pero 2010, it is recommended by the American Heart Association since 1995 pa. So, wala pa si Steve Jobs for the iPad, meron ng pad for the public access defibrillation. So, siguro dyan kinuha ni Steve Jobs yung pad. Biro lang. So, public access defibrillation. Okay? So, the goal, shorten the time from onset of sudden cardiac arrest, ventricular fibrillation, or pulseless VTAC until CPR and shock may deliver, ensuring that trained rescuers are in the area. So, yung mga lay rescuers, no, if they are, pag alam nilang gamitin kasi kakabit lang naman, the 2010 recommendation, they could use, pero dapat mga train ang sinabi doon. Okay? Pag bystander, hindi. Ang nirekomenda nila, CPR. Only. Okay? So, the AEDs are normally for arrest not caused by BF and pulseless VT or VTAC. So, pag ginamit nyo asystole, flatline, walang gamit. Pag normal, sinus treated, wala din. I think that's the highlight. Doktor, ano? Yan yung highlights. Yan ba yan? Yan yan eh. Yan blue. So, nandyan din yung AED. So, manual defibrillator. After the AED, we have the manual defibrillator. Monobasic waveform defibrillator. Sabi nga, deliver 1 current of polarity. The highest is 360. Okay? So, importante, alam nyo lang, pag nakita nyo 360 see, ito yung sinasabi ni Doctor, that's the monophasic type. So, biphasic form, that's the one we're using Philips sa ER dito sa atin. No new evidence regarding the first shock success rate, publication since 2005 guidelines, and defibrillation of relatively low energy, usually less than 200 or equal to 200 joules, is safe and has equivalent or higher efficacy than monophasic waveforms. So, pag ginamit nyo 200 or less, no? Usually kasi yan, pag dun sa mono 360, ginagamit for the bi, it's 200. Kasi yan yung pinakamataas eh. Okay, for adult, ang computation nila, approximately mga 360. That's why yung monophasic, ang pinakamataas, is 360. So, yun yung ginamit nila. So, in pediatric defibrillation, effective in terminating 48% of using of ventricular fibrillation using similar doses of monophasic. So, pareho lang siya. Pero, kadalasan ngayon, yung ginagamit na yung biphasic. Okay, this is the pads for the pedia. The right or proper placement ng pads. Internal defibrillation, usually this is indicated in a patient with VFib or pulseless beta with an open thoracotomy. Usually sa OR na to. This could be in a patient with traumatic cardiac arrest, especially yung mga vehicular accidents, for example, during open heart surgery. And the procedure requires special set of internal defibrillator paddles which should be connected to the defibrillator. Ang itsura niya, ganito. Parang ano lang yung mga dentista. So yan yung pinapatong. Pag open heart, pinapatong lang nila. So pag tumigto, nakita nila VFib. Basta yung massage nila, pwede yung VFib for that. Okay?
Kay bed car siya.
So, ito yung sinasabi ko, fixed and escalating energy. That's why 2 to 4 hanggang 10. So, pag nag-increase kayo, fixed is usually 360. No? Pag kinumpute nyo naman, for pediatrics, nag-start kayo sa 2, hindi na convert, you can add 4, or you can convert it to 4, 5, up to 10 per kilogram. So, defibrillation with implanted cardioverter defibrillator. 2005, there's no recommendation in doing such. So, every time na may pasyente na may nakikita, I'm one of the victims during my training. May dumating sa aking pasyente na arrested. Merong may ICT. So, was done sa US, apparently, may activity yung pasyente, hindi nakayanan, so di nila arrested. Tapos CPR was done, BLS, hanggang na nag-advance, so nag-convert siya into VFib. So, wala sa recommendation. So, what we did is to defibrillate the patient. So, nung na-revive, ang sabi nung asawa, doon lang niya sinabi na may makina siya doon sa loob. So, sabi namin, we're aware kami na mayroong makina, so alam namin. Pero actually, after the procedure, we discussed within the group. So, ano ba yung consequence or complication with that? So, review ng recommendation, 2005 wala pa. Apparently, wala namang nangyari within 24 hours, pero 48 hours nag-arrest ulit yung pasyente. So, 2010, lumabas yung recommendation, no, for the ICD malfunction, usually 8 cm away from the device. So, yung purpose ng paglagay dito, meron. Kasi yung paddle mo is below, dito sa kaliwa. Yung isang paddle sa kanan, right shoulder. So, malayo na siya dun sa device. Okay? So, for example, nag-kuryente kayo, dinipip nyo malapit dun sa device. So, pwede siyang mag-malfunction. Potential. There is a potential for pacemaker or the ICD to malfunction when the pads are in close proximity to the device. Okay, pwedeng huminto, mas delikado. Cardioversion naman, the second part of the discussion, the topic. So, tapos na tayo sa defibrillation. Okay? So, defibrillation, importante, ang arrest rhythm would be ventricular fibrillation and pulseless ventricular tachycardia. Okay. For cardioversion, by contrast, it is the application of electricity to attempt to terminate a still perfusing rhythm. Dun sa defibrillation, non-perfusing rhythm. Okay? So, non-perfusing rhythm are
Non-perfusing.
BFib.
BFib and pulseless
At saka pulseless
beta.
beta. Okay.
Pero sa perfusing,
Kala ko sasabihin walang pasok.
Ayun din ang ina-expect ko.
sayang.
Kasi nakakaasok yung weather, no? Sarap matulog. Lalo na walang klase kahapon. So, perfusing rhythm for cardioversion. When you say defibrillation, non-perfusing rhythm. For cardioversion, it is a perfusing rhythm. So, ano yung perfusing rhythm? It is a VTAC with a pulse. Okay? SVT, supraventricular tachycardia. Is what I'm saying before, 150 beats, more than 150 beats per minute, including atrial arrhythmias, atrial fibrillation, atrial tachycardia. Okay? So hopefully, to allow a normal sinus rhythm to restart. So by this definition, cardioversion is a less urgent procedure compared to defibrillation. Although the patient may be hypotensive or hemodynamically unstable rather than in cardiac arrest. Ibig sabihin, if it's hypotensive, mababa ang BP. Hemodynamically unstable, walang BP, mababa ang BP, wala kayong consciousness for the patient. Pero most of the time, with this, ng mga rhythm, gising ang pasyente. And mind you, isang pasyente pumasok, no? Nagsusuot lang ng pants, nag-VTAC. Pagdating ng hospital, nakapag-drive pa siya, the usual complaint, dizziness, palpitation. Pagdating, walang BP. Pero of course, may pulso. Pagkabit sa monitor, pag-ECG, SVT, is more than 150 beats, nasa 180 siya. Okay? So, in emergency, pag wala pang gamit, you can do
Vagal.
vagal maneuver.
Vagal maneuver.
Umiri kayo, pwede yun. Pero hindi mo na maisip umiri. Pagdating sa ER or field, pwede.
Carotid massage.
Carotid massage. Unilateral, dalawa. So, pwede matulog yung pasyente. So, isa lang. Okay? So, yan yung emergency pagdating sa field, pwede nyo gawin. Okay. So, unstable patients, no? Cardiac, rhythm, usually, ventricular tachycardia, pulse, VTAC with pulse, and atrial arrhythmias. So, usually for synchronization, no, pagdating sa synchronization, a shock delivery that is timed with the QRS. So pag kinabit nyo yung pads, makikita nyo doon sa monitor, so we're going to use ito or ito. So hindi nyo magagamit to AAT. Diba sinabi sa AAT, magko-convert muna into non-perfusing bago niya ma-identify kung shockable o hindi. Pero dito, once na nakita niyo sa monitor na perfusing rhythm siya, there is a button na nakalagay doon, SY and C. Sync. Tapos dito rin, may button dito, nakalagay sync. Push na lang yun. Iba na doon sa ang tawag nila dito. Parang doon sa switch. Nakasync. So, isi-sync nyo lang. Pag nakasync na yan, mapapansin nyo may mga dotted lines. Tatama doon sa palo ng PQRS. So, pag pinush nyo na yun, usually, the dose or the joules ang joules na binibigay for adults, most of the time for SVT, 120 to 200. That's the maximum. For cardio version. Pero pag defibrillation, it is 360 joules. Pag cardio version, it is 200. That is for the adult. Pagdating sa pedya, you have to compute 0.5 to 1 joules per kilogram. And you may increase up to 2 joules per kilogram for cardioversion. Pero pag defibrillation, ilan? 2 to 4 up to 10. Okay? So yun yung difference ng dalawa. And of course, the rhythm. Dalawa para dun sa defibrillation, non-perfusing rhythm, and for the perfusing rhythm for cardioversion. Okay? So, ito yung initial. This is a normal ECG. Pagdating sa baba, ito yung sinasabi ko na YQRS. Okay? Ganyan. Tingin siya. So, this is a beta. Okay? Saan makaka-identify kayo ng supraventricular tachycardia? Ganito itsura. Pag ito nagdikit, wala lang P. No? So this is an SVT. Pero dito sa slides, sa normal, data. If it's more than 150 beats per minute, that's SVT. Okay? So clear? Difference ng defibrillation and cardioversion? Okay. So any questions? Wala? Yep.
Depende kung
ang defibrillation, 300 joules doon sa monophasic. Pag biphasic, 200. Kasi ang difference, yun nga, yung sa doon sa manual defibrillator, sabi ko, we have a monophasic and the biphasic. Sa monophasic, isang polarity lang. So, the highest is 360. Nandito na yon sa device, 360 na yon. Pagdating doon sa biphasic, the highest energy na pwede nyong ibigay or nandito sa device, sa machine is 200. Kasi ang energy niya pwedeng ibigay times 2. That's why they call it biphasic. Kaya 200 lang. Okay? So yung polarity niya, of course, dalawa dahil bi. So yung 200 multiplied by 2, that's almost 360 or 400. So yun yung equivalent ng biphasic doon sa monophasic. Okay? Yun ang difference. So huwag kayong magkamali doon sa 200 na sinabi ko. 200 for the defibrillation is for the biphasic, 360 is for the monophasic. Okay? But for the defibrillation or cardioversion, the highest that you could give is 200 for adults, and for pedia, 0.5 to 1 up to 2. Pero for cardioversion or for defibrillation for pedia,
It's 2 to
2 to 4
not
to
exceeding to
10.
10.
Okay, clear? Any questions? Questions?
Dok, ano nga pong gagawin kapag po, di ba po kapag cardioversion, more on conscious po yung patient. Ano nga po muna gagawin bago gawin po yung procedure?
Usually, the question is, ano yung unang procedure pag gagawin mo yung cardioversion? Of course, gising yung pasyente nyo for the cardioversion. Pag defibrillation, pwedeng arrested yung patient. No? So, kukuryentehin nyo na lang agad. CPR, kuryente agad. Pero pag cardioversion, you have to sedate first the patient. You could give Valium, diazepam, or aside from sedation, bibigay kayo ng opioids para hindi naman masaktan yung pasyente. Kasi baka na-excite kayo, bigla yung kinuryente, sisipa yan, sigurado yung sipa niya diretso sa mukha niya. May nangyari na ganyan. Dumating siya, excited yung residente, kinuryente. Abot-abot ang mura hanggang sa from duty na siya, minumura pa siya. Kasi pagdating ng ground, ikaw yung kumuryente sa akin. Sabi ng pasyente. Tatandaan kita, doktor, hindi ko makakalimutan ang mukha mo. Kulang na lang, patato. So you have to sedate the patient first. The last, pacing. So, ER physicians usually do pacing. Merong nabibili na defibrillator na pwede nyo i-convert into pacer. Hindi ganito ng machine kasi that's invasive. Yung pacer, para din siyang pads, ilalagay nyo lang, pag mabagal, kukuryentehin niya, i-convert niya. So, merong ganun na defibrillator ngayon. Okay? But this one, usually, this is not effective for systolic cardiac arrest and may delay or interrupt the delivery of chest compressions. It is indicated usually yung mga pacing na to or pacer for symptomatic bradycardia. Ibig sabihin, less than 50. Ilan yung pwede kayong mag-CPR? Ilang beats? Less than ilan? How many beats per minute? Bago nyo sabihin, isi-CPR ko na to. 20, 30, 40? Ilan? Ako pag may quiz, bagsak. Ha? 60?
Less than 60.
Less than?
Pag
Less than
medyo yung,
60?
di ba?
50. Less than? So, nagsabi ng 40.
Wala, pataasin mo.
Ako
Yung
less
40.
than wala. Wala kasi pulseless.
Mga hindi sigurado. Okay, questions?
Dok, ano po sagot?
Ano ba ang sagot?
Review niyo yung lecture last week.
Less than 60 na.
Ilan?
Mas,
20, 30, 40, 50, 60.
less than
Less than 60.
60. Pag ano?
Hindi.
Pag bata. Medyo.
Less than 40.
Ilan?
Ano?
Hindi, think this is
Less
the last
than
time
60.
Less than
for this
60 po.
topic.
Less than 60.
Less than
60
60 beats per minute bago kayo sabihin
CPR.
nyo na mag-CPR. Ilan?
Opo.
Less than
Maricol. Ano mo sinabi sa doktor?
Oo ata.
Pagbata.
Magbata yan. Eh, ano mo tinatanong?
Baka ano, no pulse within less than 10 seconds. Diba? Pag no pulse, pag ano, without 10 seconds,
No pulse.
no pulse. Ano ka, doktor? Mag-CPR pag ano, no pulse within less than 10 seconds.
No pulse.
Doc, no pulse, less than 10 seconds.
Eh, less than 10 seconds yung pag-CPR nyo. Yung shift should be less than 10 seconds yun. Pag-shift at saka yung pag-check, so less than 10 seconds. Pero yung heartbeat, kunwari dumating o nakita nyo yung pasyente, gasping, hindi siya paisa-isa yung paghinga. Tapos pinusuhan nyo ang pulse is ilan? Mga 40 or 30 beats. So magsi-CPR ba kayo o hindi? Or
40 to 30.
For amplification.
Siguro.
Ano ba?
Kung nga may bubuli.
Pag-iit niya ka muna. O sige.
so assure attendance, no, wala namang sinabi na ano. Ito yung 1/4 sheet. Yellow.
Hala, wala ako.
Ano?
Wala ako friend. Ay, shucks. Class representative. Sinasama niya daw si mama niya na magpa-dialysis. Ilang beses bang nagpa 2 times a week?